Good Monday morning. It is July 19th. I'm Jessica Lovell. Welcome into the morning medical update. We will get an update on our COVID cases here in just a few seconds, but we are also talking about getting back on the field. It is that time for the Kansas City Chiefs training camp. It's not just professional athletes that are working hard right now. We look at how you can keep your kiddos safe on the field and safe from COVID-19 as they head back to school sports and those get underway. But first, let's get straight to our COVID count this morning. Lance Williamson, good to see you. He's joining us in place of Dr. Hawkinson today. So good morning. How are you?
Thank you, Jessica. I'm good.
All right, let's get to those COVID numbers. What do you got for us?
Yeah, so we watched this over the weekend, and we've seen a steady increase, unfortunately. So we have 54 total patients in the hospital. 38 of those are active infections. The rest of those have met criteria to discontinue isolation. And then we have 13 patients in the ICU, and then 5 of those on ventilators. And then across Kansas, we see 5 patients at Hays and 2 at Great Bend. So increases all around over the weekend from what we saw last week.
So numbers still not good. That's kind of the story we've been sharing over the last week and a half or so. So we want to just check and see if we have any reporter questions on the line today.
Sure. Good morning. Cody Holyoke with Channel 9.
Hey, Cody.
Lance, lucky you to answer a couple of questions that we have today. First, as we start to see, and I mean, 54, I mean, that's a significant number that you're dealing with. You guys are behind the curtain a little bit in dealing with health officials and mask questions and things like that. I've heard a number of health officials say that mask mandates, requiring masks might be one of the only ways to try to curb the numbers. What are you seeing and what are your thoughts on that?
Yeah, so we saw over the weekend, LA County was one of the first kind of large counties to take a stand on this and kind of re-implement those mask mandates. I think if we see that things get more unsafe for even fully vaccinated people, depending on what we find from Delta variant, next week may be even less safe than this week if you're wearing your mask in an indoor setting and you don't know everyone's vaccination status. So it's changing week by week, and I think that states and counties, local governments are going to have to take a hard look at their community numbers and make changes based off of what might be needed. And we know masking is a really easy way to stop the transmission of this. So especially when you're unsure of the unvaccinated people versus vaccinated people in an area, it's just easier to have everyone wear a mask so you know that they're all doing that one basic precaution. So we'll see that hopefully in the future, taking into account if it's less safe going forward if numbers keep increasing in our area.
This is breaking news this morning that there was an alternate on the U.S. women's gymnastics team that tested positive for COVID-19. We're still working to see if it's one of our local gymnasts, but does this put a bullet on the need to take this pandemic seriously, or what are your thoughts as you're seeing this news?
It's concerning for sure. I think, we've seen a couple other in the village where the athletes are living where they're testing positive. So it's concerning for sure. I know that they've taken a lot of precautions there, but I think every time we see this, we think about it in our own communities and thinking about the risk may be changing for us too. So definitely concerning.
And just a quick follow-up, you said that next week might be more unsafe than this week. What do you mean by that?
I mean, if numbers are increasing, case counts, death counts, we may see that this trend is not going in the way that we want it to. So if it keeps increasing, then we may need to make changes based off of what we know works in our communities to prevent spread, in addition to vaccines.
All right, thank you.
Thank you.
Any other questions today? Okay, to our community, start sending in your questions right now. We're going to get those answered for you here very shortly, but let's turn to our guest today. We're so glad to have Dr. Paul Schroeppel, head orthopedic surgeon for the Kansas City Chiefs, also one of our great doctors here at the health system. So in case you're wondering, he is the man who popped back Patrick Mahomes' knee. You remember that Thursday night game in Denver. You can't forget that. How are you?
I'm good, thank you.
Okay, but you do a lot more than just Patrick Mahomes. We know that. We know that. I do have to ask, this is kind of in your wheelhouse, your thoughts on what Cody had just talked about with the gymnastics player. What can you you. What kind of insight can you give us on that?
Well, I just heard what Cody did too this morning on the news. So as far as I know, this is the only, it's an isolated case. And I think it's going to be nearly impossible to go through this whole process without having any cases. The NFL saw that. The NFL had some of the most stringent guidelines in the way we tested and the way we risk mitigated last year. So I think if they follow appropriate isolation protocols and continue to be very vigilant, hopefully it's an isolated case.
Yeah, it's just, it's sports in the middle of a pandemic. It's just all part of it, right?
Yeah.
Yeah. Okay, so you are heading to training camp. It is back in St. Joseph this year. It's open to the public. It will be a limited capacity. No surprise there. But what worries you about St. Joe right now with the spike in cases that we're seeing all over as far as keeping people safe? What can you tell us?
Yeah, I think the league has very strict protocols in kind of the tiering system and who's exposed to what, and the distances between certain fans and players. And so I think they've done everything they can to control transmission in those situations. Of course, when you get a crowd together, it's going to be very difficult, particularly for those unvaccinated. So we'll continue to encourage everyone, 12 and over, to get their vaccine. But I think they're being very vigilant and doing a lot to try to control that risk.
Yeah, what feels different from last year to this year? A lot probably feels a little the same, I would imagine.
Yeah, exactly. So, if you go back, I guess what's different from 2 years ago, nearly everything. I mean, so we all, last year had to test every single day. We tested, well over 100 days in a row. There's a lot of, so you do connects on contact tracers and things to do proximity testing so we can go back and contact trace if there is a positive. Thankfully, some of those have relaxed a little bit. The league is really, in an effort to encourage vaccinations, has tried to change the regulations based on, your vaccination status, but still, very critical and really looking at all the potential risks and trying to mitigate that.
Are vaccinations required among the players?
They're not required.
Not required. But do you think they'll be doing as much testing? I mean, just with this new variant, do you think they'll be really checking people's status and how they're feeling as much as they were this time last year?
Yeah, so I think they're constantly kind of morphing their protocols and regulations based on the current environment. And so Dr. Alan Sills, who heads up the medical team for the NFL, does an exceptional job. And, I think, there may be some changes depending on what happens with those numbers.
So, what I want to know kind of what you're looking for this year, that you're looking for the pros that maybe parents might have a takeaway as they're getting their kids back on the field. Anything that they should be looking for, keeping in mind? What can your insight be for them?
Well, I think we see a lot of consistent things aside from COVID when the football season starts or when all fall sports start. Soft tissue injuries is a big one. So the NFL has put a heavy focus in research. They just awarded a $4 million research grant to University of Wisconsin to look at potential prevention techniques for namely hamstring strains, but all soft tissue strains. So we know that that's a consistent problem when we return to sport. Hydration plays a part in that, so really maintaining a hydration status and making sure you avoid excessive dehydration and heat injury, but then also acclimatization, so preparing to return for those for the fall sports, including football. So not just showing up at practice thinking that's going to be your conditioning, but conditioning to be football or sport ready when you begin that fall camp in August.
So I have to ask you that question. I'm sure you get asked all the time. Just what is it like working with the Chiefs? I mean, working on a pro level, even though you and your team take care of way more of our local student athletes. But what is that like? What's it like working with the organization?
Well, the organization's fantastic. I mean, top to bottom, we've got a great front office. We've got a great kind of medical staff. Rick Burkholder, our head trainer, does an exceptional job, and his whole staff is great too. So it's a pleasure for us to get to work with them, and it's a pleasure to get to see kind of the most elite athletes in the world, and get to see how they respond to injury and then have the resources that we get in the NFL to help manage injury.
And we love sharing your story because that really tells people, though, that people get to be treated kind of like a Chiefs player when they come here and get treated by our physicians. So sure. We love hearing that. Of course, as we've always said, you don't just treat those professional athletes, but the kids in our community. So we spoke with a patient of yours who was able to come back to sports after suffering really what could have been a career-ending injury. Here's Patranya Poonswan with how he got back to the sports he loves.
Good morning. We caught up with one high school athlete who, just as quickly as he was sidelined by a major injury, was back on the field and ready to win.
All right, here we go. Left middle.
Watching 17-year-old Michael Solomon practice football with his teammates,
Right again. Here we go.
it's hard to believe that less than a year ago, this Blue Valley High School senior sustained an injury so serious it ended his high school football season.
I heard it snap and I was like, it's broken.
Michael describes the moment his collarbone fractured when he was tackled by another player during a game last November.
I got landed on and it actually snapped in half, and I think it was broken before that, so that's made it worse.
With this injury, I knew immediately that something was wrong because of his body language.
Caitlin Truhe is an athletic trainer with the University of Kansas Health System. She works with student athletes to train and prevent injuries. Truhe was on the sideline the day Michael was injured.
There's varying degrees of collarbone fractures. Michael's case, the fracture was displaced enough that he needed surgery in order to repair that so then it could heal.
The next day, Michael was able to get into the health system's weekend clinic for an x-ray to confirm his broken collarbone. Soon after, he was in the hands of orthopedic surgeon Dr. Paul Schroeppel, sports medicine expert and head orthopedic surgeon for the Kansas City Chiefs.
Having somebody on site all the time is huge for me. And it also gives me a comfort level of knowing if a kid is injured or if they have a sickness or an illness, that they're going to be taken care of properly immediately.
Michael has surgery and is now back at it.
He did really well. After he had surgery, he was actually pain-free, and so he was ready to do activity long before the doctor said that he was ready to do it.
In fact, this past February, Michael, who is also a wrestler, competed in a regional high school wrestling championship and came in first place. He took second in the state competition.
So, Dr. Schroeppel, I have to ask you, we had great outcome for Michael, by the way, but how important is Michael and patients like Michael, his determination to get better, staying up with his physical therapy? Walk us through that.
Yeah, so I think it's critical within any injury, and also kind of following our restrictions. So most importantly for some of these fractures, some of our ligamentous reconstructions, meniscal repairs, et cetera, those first couple months are critical that they do what we ask them to do and really follow the restrictions that we place on them to allow things to heal appropriately, followed by a fairly rigorous rehab protocol and return to sport, which is equally important.
Well, and they have age on their side, so that can help, right?
That
so,
certainly
yeah,
helps.
encourage that. It always does. Okay, so tell us a little bit about this program, the partnership we have with our local middle schools and high schools. How many, and how does that all work? And these physicians, we saw Dr. David Smith. He'll be out here tomorrow. He was there on the sideline. How does that work?
Yeah, so we have an athletic trainer full-time at each of these high schools, Blue Valley High Schools, Shawnee Mission High Schools, DeSoto, et cetera. And they work very closely with us. We have physicians at every, particularly every football game and some other events as well. So whether that's an orthopedic surgeon or a non-operative sports medicine specialist. So we work very closely together, and I think they're excellent communicators back to us as far as injury. So it's exceptionally useful as we're returning those athletes to sport to be able to have a kind of a real-time dialogue about how they're progressing back into the sport, any concerns that the athletic trainer may see. And then certainly in response to an injury, we have a very open communication so that we can get our athletes in generally within 24 hours or less and really expedite the care process.
Yeah, addressed immediately. So a couple more quick questions, and we're going to get to our community questions here in just a minute. So how else can students prep for the fall? Any advice you have for students, parents? What do you got?
Yeah, I think when you get back to the soft tissue injury standpoint that we were talking about, acclimatization, so preparing your body for the rigors of whatever your fall sport is probably the most important. I think if you chose one, you can really drill down on hydration and sleep health and nutrition, and they're all important. But again, preparing your body to accommodate those workloads that you're going to be seeing in the near future.
Yeah, so that was one of my questions, was about like sleeping, nutrition. I mean, we talk about that for kids who aren't athletes, making sure that they're doing that. But how important is that, and what advice do you have for parents about kind of putting a lot of that on the kids too? Because these are, high school kids as well, and kids that should be kind of taking that on and making sure that when they're not at home that they're putting that first. What advice can you give them about that?
Well, so sleep hygiene is actually getting a lot of focus right now as potential performance enhancement because so many people have poor sleep hygiene. Going to bed late, waking up too many times throughout the night. a number of different stimulants, caffeine, et cetera, can affect that as well. So devices, absolutely. Really anything that's kind of keeping your mind going and preventing you from getting into those deeper phases of sleep. So getting to bed on time and having a fairly routine schedule, I think, is very important.
And starting that early.
Yep.
Starting that early in the summer. So, okay, so we know we'll have some questions. Jill, good morning to you, by the way, for Dr. Schroeppel. So let's get to those community questions and let's get us started.
Yes, we have some that are on topic. So I'm going to start with Dr. Schroeppel. Rick wants to know, tell us about the screenings that will be done on the players, and will there be contact tracing if anyone is tested positive?
Yeah, Rick, good question. So we're still kind of ironing some of that out. I know we have a meeting tomorrow night later this week, I think, to really discuss the final implementation of some of those screenings. It won't be quite as rigorous for those that are vaccinated this year as it was last year. Again, this is a constantly evolving process, so depending on probably the environment in our communities, but then also, I think rates of positives and issues amongst teams, the league will continue to adapt to that. But yes, contact tracing and testing are still going to be very important aspects of how we keep everybody safe.
And Julie wants to know, I'm headed to St. Joseph to watch for the training camp. She said, will fans have any opportunity to interact with the athletes this year?
Unfortunately, not directly. There will be distance requirements between fans and players, just for the pure reason of the inability to determine who's vaccinated and that sort of thing. So they'll be on site, but direct contact probably not.
So get to wave to them.
Yeah.
Thanks, bye.
Yep.
Well, wave to you too. Isaac wants to know, he doesn't know if you'll know the answer to this, but will the stadium be allowed to be full capacity this fall at Arrowhead?
That's the intent. And again, things can always change in response to the environment, but as far as I'm aware, they plan on filling the stadium.
And Cindy and Kitty want to know, if I come to the stadium, will I have to wear a mask? Will masks be mandated?
I don't think they've released that final policy yet. There's certainly a chance, so we'll just have to see how, again, kind of what changes in the, community numbers.
Okay, and you're just feeling about masking in general. Wendy and a lot of people have questions about masks. As a physician, what do you think?
Well, I think it's a safe way to mitigate risk as a result of COVID. And I would still encourage everyone to get vaccinated. I do think that there's some importance in providing incentive to the vaccinated individuals and distinguishing those that are vaccinated and unvaccinated as far as reducing mask requirements. But again, masking is a very simple risk mitigation technique that everyone can employ. So if you're unvaccinated, then certainly I think in any crowded spaces, particularly inside, you need to continue to wear your mask.
Okay, and this question is kind of a COVID question. It might fall in your wheelhouse, Dr. Schroeppel. I'm not completely sure. But the question is from no, not Carla. Hold on. Hold, please. Let me find it. The question is someone got a Pfizer vaccine, and after the first shot, days later, this is Carla, yeah, and they had severe foot pain. They went to the doctor the next week, and now they've got bad gout with high uric acid levels. They've been put on 3 meds and antibiotics. Any chance that that could have been caused by the vaccine?
Well, I think it's difficult to say that it's impossible or that there's a 0% chance. It'd be very unlikely, though, that gout would be a result of a COVID vaccine, whether it's Pfizer, Moderna, et cetera. We have seen a very small number of kind of acute shoulder pain, but it's generally not gout. So gout obviously is a little bit different inflammatory arthropathy with crystal deposition that kind of drives that inflammation. But we have seen kind of some reactive bursitis around the shoulder. But again, those numbers are exceptionally small. Small fraction, 1% get a response like that.
And remind us, what is gout? I remember my dad had it at one point, and they said it was tied to his diet.
Yep. So you had mentioned uric acid levels. So it's the inability for your body to efficiently break down those uric acid products, and so they can lead to some accumulation of crystals in the joints. Usually the big toe is probably the most often affected, but it can affect any joint, and it creates this acute inflammatory response in the joint.
All right, Ruthie wants to know, do people that have had COVID-19 in May of 2020, do they have any protection now without the vaccine?
Yeah, Lance I think, is going to chime in on this one.
So we know that the antibody response, the immune response you get from the vaccine is much more robust than what you would get from a natural infection. So it's hard to tell. I think I wish Dr. Hawkinson was here to help me with this, but I do know that you really want to rely on that immunity response from the vaccine. And if you're asking if one's better than the other, the vaccine, the immune response from the vaccine is going to be more robust, going to protect you better than a natural infection. So especially one that's over a year old. So I would say if the question is, what's my protection like now? I think we're really unsure, and so we would want you to get the vaccine to boost that protection.
Okay, Catherine wants to know, what are the vaccination rates for the Chiefs organization? Are they releasing that?
I don't know that they've released it, and I honestly don't know the current numbers, but I know we're doing quite well amongst the league. And actually the league has, what did I see last week? I think almost half of the teams, I think, have a vaccination rate of 80 or 85%. So the league in general is doing a very good job, and the Chiefs organization certainly is too.
And then her follow-up question is, do they have reasons for why they are avoiding the vaccine right now or hesitant?
You know, I think that's a person-by-person question, and I think people maybe are vaccine hesitant for different reasons. We certainly do everything we can to provide them the best information to guide their decision and really encourage them that it is safe, and it is both the safest for them and for the people around them to get vaccinated.
Okay, and Judy wants to know, what's the level of cooperation, non-cooperation with contact tracers? Are we hearing any stories about that? We're still doing contact tracing, correct?
Yeah, we're still doing contact tracing, and the states are as well. I think that, the more that we go down this road, the more people get used to things like this. So it's still very important. We've been doing contact tracing for, 50 years. It's a really great way for us to make sure we try to control this. But it's a little different now that a lot of the population is vaccinated, because we do have different requirements for people who have been exposed who are vaccinated. So you may see some changes with that, but otherwise it still is really important.
And Lance, Shirley wants to know, should hospitals keep COVID patients separate on different floors of the hospital? You want to talk about how we handle our COVID patients here?
Yeah, so we do cohort our patients who are sick with COVID to specific units. Part of that is operational because we have, it's a similar illness for most folks, so we have trained staff who are all in the same area who can help those patients. We put the patients in isolation where we wear personal protective equipment, so it protects the healthcare worker and the other patients and the outside environment, so we do a really good job with that. But there are operational reasons. It's usually easier to have those patients in the same area for lots of different reasons.
Okay, and Wendy says, kids clearly get COVID. What are your thoughts on schools without mask mandates? Kids aren't vaccinated.
Yeah, so there's been some interesting articles recently about how, are we concerned that COVID is going to be a young person's disease going forward now that most of the vaccinated population, we started with our oldest individuals in our population. So when the virus can't transmit between that older population that we saw when no one was vaccinated, is it going to move to younger bodies because those are the people that are now susceptible? I think we need to see more information to know if this will really have an effect. We know schools can function safely if they put in place those basic infection control measures. We saw it over the last year. So I do think there are some sensible things that schools can do to stay safe. And in a large group with unvaccinated people, most of those people are young kids who aren't eligible for the vaccine. I would say adults should still be masking.
Dr. Schroeppel, what are your thoughts about that? You've got young kids too.
Sure. Yeah, so again, I think we can't encourage enough that people get vaccinated that are eligible. I think all of us want to get back to real life. In the sports world, we want nothing more than full stadiums and normal games and, the kind of the more intimate contacts that we get and the excitement that we get from all of these sports. But the longer that people continue to go unvaccinated, the longer we continue to have these spikes and fight with COVID, the longer it's going to be before we get back to some of that normalcy. So really encourage everybody to get vaccinated if eligible.
Would you like to see kids wearing masks back in school as we kick off the school year, at least initially? What are your thoughts?
Yeah, I think it's going to be difficult as numbers continue to go up to avoid doing that.
Jennifer, Joanne, and Lori want to know about the numbers in our hospital right now. They want to know, do you know how many are breakthrough infections and if they are all the new variant, the Delta?
Yeah, so we report breakthrough infections to the state health department, who then reports it to the CDC. We don't see very many breakthrough infections. I think when we looked at it in June, nationally there was around 6,000 breakthrough infections. So out of all the infections, it's a very small sample of those. And so those breakthrough infections that we send off do get tested for the Delta variant, and then we see, the sewage system testing of Delta variant, so we can assume that the predominant variant, even in our hospital, is the Delta variant. We know in the United States it's really the most likely predominant variant, so that is likely.
Okay, and I think Taylor Himness is on the line. Taylor, did you have a question beyond that?
Yes, hi guys. I'm glad that viewer question came in about breakthrough cases. We just wanted to ask also about, because these cases we're now hearing coming out of the Olympics with some of our athletes potentially are breakthrough cases, that kind of thing. Has the best practices for people who test positive after being vaccinated, are they different than they were pre-vaccination? Because we knew what we were supposed to do, a year ago, less than a year ago, if we tested positive as far as isolation, do this, that kind of thing. Are they any different, or people should expect anything different if they test positive? What's going to happen with some of these breakthrough cases that we're seeing now?
Yeah, the answer to that is no. There's no difference in your isolation precautions after that, what you need to do. So a positive test is a positive test, and when you don't have symptoms to go off of, we still recommend that 10 days after that positive test that you isolate.
Okay.
Thank you.
Thank you.
Is that good? Lilith, my favorite name. How many deaths have you had this month due to COVID? She wants to know. And have you had any pediatric patients?
So we last Friday we had a pediatric patient that we talked about on this show. That was the youngest one we've had. I think they were 8 weeks old. And so we do see them here and there. I know Children's Mercy has seen them as well. And then as far as COVID deaths, we saw a decrease in May and June, definitely lower numbers than we had seen in early spring and, of course, in December and January. We have seen them spike up a bit, especially now that we have almost 40 patients with active disease in our hospital. So we are seeing that increase.
Okay, and I think that we'll take one or two more questions. One of them is, do we know, there's a person that writes in and said they've been talking with KU and someone in internal medicine, and they're talking that they're seeing a lot of breakthrough infections in their clinics. Do we know if that's accurate? And there's not, a lot can mean different thing to different people.
Mm-hmm. Yeah, and I think officially, CDC requires us to report breakthrough infections, and the definition that the CDC has for breakthrough infections is people who are hospitalized or die from COVID who have been vaccinated. So no longer, at the beginning, they were counting all the patients who, had very mild illness or even asymptomatic and just had been tested for whatever reason, but that's no longer considered a breakthrough infection as far as national reporting. So I think we will see those here and there, and especially if people are getting tested for, getting on a plane or doing other things, you may see those pop up. But as far as public reporting, it's really those hospitalized and patients who die that are being reported nationally that we see.
Okay, and Kitty gets the last question this morning. Why doesn't the FDA approve vaccination sooner for children if they are now more at risk? I do know that I think, Jess, isn't Dr. Pahud on like Thursday? Is going to join us from Children's Mercy?
I believe so, but I'll confirm that. And we also have Dr. Lauer on that day as well. So yeah, we'll be talking about that for sure.
Lance, do you have any feelings on that?
You know, I think it's a testament for how important those clinical trials are and how important it is for vaccine safety and efficacy studies to happen. It's a race, right? We want to make sure that people get vaccinated and they get approved as soon as possible. But we're really strict on vaccine safety and efficiency, and that's why we can be so confident to tell you that the people who are eligible for the vaccine now, it's extremely safe to get the vaccine.
All right, great.
That's all I have right now. So back to you.
Thanks, Jill. Great questions from the community today, as always. Okay, let's get to our final thoughts from our guest, Dr. Schroeppel. I'm going to start with you. What do we need to be keeping in mind? It was just getting our kids back safely to the field, but now we have the COVID numbers to start to consider. What can you add for that?
Well, I think the COVID mitigation strategies, masking, et cetera, are well established. So I think if you're putting yourself in a situation where you're potentially exposed in a close proximity to a lot of unvaccinated individuals, those are situations where you probably need to wear your mask or, again, certainly should be vaccinated yourself. I think when it comes to return to sports, I think we've demonstrated in multiple sports that kids can go back and play reasonably safely. And I think hopefully the regional numbers will, stagnate or start to decline, and we can start moving more towards normalcy. But I think you have to implement some of those risk mitigation techniques when you're not out on the field, playing football, playing soccer, et cetera.
Yeah, we did all this last year, so people are kind of used to it. And that you leave for St. Joe next week?
Correct. Yeah.
And you'll be there how many weeks?
We'll be up there a little over 3.
Okay. And
Jessica?
Yes, ma'am.
We do have Kimberly Jordan from 41. She wants to ask a question. It's just
okay. Go ahead.
late.
Hey, how are ya? Is she on?
Well, the question is, what about false positives when it comes to tests? Are our tests better at not letting that happen?
Yeah, so anytime you have a PCR test, a test that is probably going to be the most likely test you'll get, it's going to be very sensitive, so it will definitely get a positive if it's there. Sometimes they're more sensitive where you may not even be infectious anymore, but it'll still test positive. It's a very sensitive test. Now, an antigen test is really designed to test when you're most infectious, so it's more likely that you might have a false positive or false negative with those, but I think really by this point in the pandemic, we definitely can trust the tests that we have available.
All right, Dr. Schroeppel, thanks so much for being on today.
Sure, my pleasure.
Take care of those players. Stay safe up there. We'll see you when you get back.
Will do. Thank you.
Thanks so much. All right, Lance, final thoughts from you.
I think just I want the community to think about being agile. We see changes every week, like I talked about. Next week might be a little different than this week, depending on the numbers. So there may be times when if you feel like the numbers are going the wrong way, you want to put a mask on when you go in the grocery store now, you can do that. We should all be agile with what we're doing with our infection prevention and control measures, putting them in place if we need to, and then taking them off as we feel comfortable and we're guided by our regulations.
Great message. Good to see your face today, Lance. Glad to have you join us. Dr. Hawkinson needed some much needed time off. So, of course, he's doing it right. He's doing it safe as he always does. He's masked up, still wearing eye protection as he's always done when he traveled during this pandemic. So a lot of people back to their old habits as these numbers start to take a turn. So, hey, thanks so much for being with us today. Tomorrow we are back with new recommendations for athletes in Kansas. What does the Delta variant coupled with less masking mean for fall sports? We break down the new guidelines, plus the changes school nurses are making to protect your children. And Jill, have you heard from Dr. Stites? Is he joining me tomorrow?
Haven't heard.
Haven't heard. Okay. So he may be a surprise guest. So everyone have a great day. Thanks so much for joining us. Make it a great Monday.